I'm Dr. Randy Martin, and I'm joined now by Dr. Anders Cohen. Anders is from King's College Hospital in London, and he's going to tell us a little bit about the Magellan trial, which was a fascinating trial. Looked at Rivaroxaban compared to enoxaparin for prevention of DVT in non-surgical but acutely ill medical patients. Anders, thanks for joining me.
My pleasure, Randy.
Tell me a little bit about the study.
Well, the study was the biggest study of its kind. We did over 8,100 patients. They were a diverse group of patients. They had things like heart failure, respiratory failure, infectious disease, stroke, cancer, and they were typical sick medical.
Kind we'd see in the hospital.
Yeah, exactly. Typical sick medical patients who are at risk of venous thromboembolism. So our aim was to reduce the frequency of pulmonary embolism and DVT in these patients.
And you looked at this unique oral agent versus a sub-Q agent, is that correct?
Exactly. We looked at Rivaroxaban, which is a direct oral factor 10 inhibitor, and it's been used successfully in a number of settings.
Right.
And we compared that with the standard of therapy, which was enoxaparin 40 milligrams.
So the obvious question is, what's the take-home message out of the trial?
The take-home message is that Rivaroxaban is as effective as enoxaparin in the short-term thromboprophylaxis, 1 to 2 weeks. Rivaroxaban is more effective than enoxaparin with a 23% relative risk reduction at 5 weeks. But there was an increased rate of bleeding in the Rivaroxaban arm, and although the bleeding was really infrequent, we used a very sensitive measure of bleeding, and we are looking to see which patients would have the best.
But was the bleeding, was it major bleeds or minor things?
Well, we added them both together.
Okay.
So our outcome was major bleeds and clinically relevant non-major bleeds.
Okay.
So we had things like patients who had nosebleeds or large ecchymoses, as well as patients that had more severe bleeding.
Well, I mean, I think it's, it continues this I think a fascinating time for us since I've been in cardiology forever, and having oral agents that are very effective. And Rivaroxaban is a once-a-day drug, is that correct?
That's correct, yeah. The Rivaroxaban is used in prevention at 10 milligrams once a day. In our DVT and PE treatment studies, we've been using 20 milligrams once daily. In our atrial fibrillation studies, we've been using 20 milligrams once daily, and it's been very safe and effective in all the settings.
Final question, are you going to continue this trial?
We're going to look long and hard at this trial and look at the subgroups. We know that some subgroups did better than others, and we're going to do further analysis.
Good, super. Well, Anders, thanks so much for joining me. It's a great trial, and I appreciate you spending the time with us.
My pleasure, Randy. Thank you very much.
Good.